Matt Van Swole took his wife to the hospital in March. She had stomach pain, and the doctors ordered a CT scan of her abdomen. The results came back negative. She wasn't admitted, didn't undergo any treatment, and never stayed the night. The scan was the beginning and the end of it. The total bill came to over $9,000. That's what it cost for an American to hear that everything looked normal. In Israel, this kind of bill wouldn't happen. Every citizen is enrolled in one of four nonprofit public health funds, Kupot Holim, and CT scans are part of the basic package. Most people pay somewhere around $50, if anything at all. Their model doesn't cough up numbers like that. American healthcare prints bills like this on purpose. The pricing structure, bloated, obscure, and padded like a consulting invoice, is calibrated and reinforced at every level. Nearly $9,000 for the scan, a couple hundred more for supplies. That plastic hospital bracelet exists for billing. It's a barcode on a wrist, a price tag that moves. The moment it prints, the math begins. Matt followed instructions. He scheduled the visit, signed the papers, maybe even sat in the waiting room while his wife got scanned. He did everything they asked and walked out holding paperwork that read like a financial threat. In 2000, Donald Trump published a book called The America We Deserve. In it, he supported health care for all. And this is a direct quote. "We must have universal health care. Just imagine the improved quality of life for our society as a whole. The Canadian plan also helps Canadians live longer and healthier than Americans. We need, as a nation, to re-examine the single-payer plan." That version of Trump came before the donors. By 2020, he was calling Medicare for all a socialist nightmare and warning it would destroy your Medicare. Then he approved billions more for Israel, called their society incredible, and said nothing about the state-run medical infrastructure that keeps it running. He praised the country, funded the structure, and stayed quiet about who pays. The man who once wanted health care for everyone now fuels hospitals in Tel Aviv while Americans Google how much blood they can lose before it gets serious. In May 2019, Ron DeSantis publicly warned against expanding healthcare access in the U.S. He said, and this is a direct quote, "Medicare for all would be a reckless socialist experiment that would hurt seniors and destroy innovation." Then he traveled to Israel, signed partnership legislation with Israel, and praised Israel's innovation without once mentioning that every Israeli citizen receives government-backed medical access. He wasn't confused. He knew exactly what kind of socialism he was endorsing. The kind that sends American tax dollars to cover health care in Israel and sticks the bill to white men writing the checks for Jews. Ted Cruz called Medicare for all a threat to American liberty. Sent your money to fund free checkups for Jews with better dental infrastructure than Texas. Mike Pence said socialized medicine would collapse the economy. Covered the cost for a country that somehow manages free cancer screenings and missile defense on the same budget. Kevin McCarthy warned that government-run healthcare would end freedom. Backed billions for a state-run system where you get surgery and surveillance on the same floor. Israel doesn't debate whether healthcare should be public. They assigned it. Every legal resident is placed into one of four state-mandated health funds called Kupot Holim. Enrollment is automatic, participation is mandatory, and the money moves through payroll. You pay the state pays the fund pays the provider. The basic tier includes everything from scans to surgeries. Most of it's paid for before you ever see a doctor. It runs like a utility. You fund it. They turn it on. Israel doesn't have to choose between MRI machines and missile defense. That's already settled. The U.S. sends $3.8 billion a year under the Foreign Military Financing Program. That money covers air defense, procurement, and long-term readiness. When Israel builds out its healthcare system, it's not pulling from the same pot. They don't need austerity. They have Americans. Every tax dollar that goes to Israeli security takes pressure off their domestic budget. That's how the trade works. They get full medical benefits. You get the invoice. The bill doesn't pause for diplomacy. In the 12-day proxy conflict with Iran in June 2025, U.S. Navy ships intercepted missiles and enforced airspace over the Red Sea without congressional approval. Still, taxpayer money moves straight into action. Analysts estimate the U.S. incurred between $1 and $2 billion in direct costs supporting Israel during those 12 days. That support kept Israeli hospitals funded, budgets intact, and public services untouched while rockets flew over Tel Aviv. Since October 2023, the U.S. has approved an additional $17.9 billion in emergency aid to Israel. Most of it goes to missile defense, weapons replenishment, and wartime logistics. That's on top of the annual $3.8 billion and part of a long-standing pattern, totaling over $310 billion in inflation-adjusted aid since 1948. Every safety net you were told we couldn't build at home now shows up overseas, fully assembled. You paid for cradle-to-grave benefits, just not your cradle, and definitely not your grave.